This conference will now be recorded.
Hello, and welcome to part one of the post-op nutrition class. We're going to be focusing on what happens during weeks 1 and 2 after your surgery and what you are supposed to consume. So at this point, you are either still in the hospital or have just left, where you have been consuming fluids, anything that's a clear liquid, 1 ounce at a time every 15 minutes. So you're most likely consuming 4 of these every hour. So now that you are home and that you are no longer under close monitoring, your portions can increase. So you are still on a clear liquid diet. However, now the amounts that you will be able to consume at one time is 3 ounces or equivalent to something of this size. So the first week, or about 5 days after surgery, you will be consuming all of the products that you consumed the day before surgery, though now you're allowed to do red and purple, and then also what you were given in the hospital. So this includes the standards, the sugar-free Gatorades, decaf tea or coffee without cream, sugar-free Jello, sugar-free popsicles, various protein waters or protein juices, as I call them, and even small amounts of pulp-free juice. So essentially, your goal will be to consume about 3 ounces every 2 hours. The nutrition guidebook has a very clear example of what a day should look like. So if you were to go on page 26, you will see that a sample day is mapped out for you. And essentially, it's every 2 hours you consume 3 ounces of one of the mentioned beverages. And in between that, you take small sips of water. So remember that at this point, you may not feel the tightness in your stomach. So you may feel like you're able to drink more, but I highly do not recommend you do that because your stomach is indeed very small. So the best thing to do would be stick to the guidelines of 3 ounces of one of the fluids you see on the slides, and then little sips of water in between. So as mentioned, this diet, you spend one of the days is at the surgery. The next day is, sometime at the end of the day you leave. So post-op day 2 is the first full day of clear liquids that you do at home. So moving on to the second week, on day 6 after surgery, you can now start full liquids. This is basically the addition of milk and dairy into what you're allowed to have, which really does expand your options. So your standard protein drink, whether it's a pre-made shake or a powder, is an excellent thing to start right now. You can also do light, low-fat yogurts. You just have to make sure that it's not Greek yogurt, that it's relatively low-fat, and most importantly, that it doesn't have actual pieces of fruits in it. So you would have to get a flavor that doesn't involve some kind of berries for this particular phase. You can also do cream soups. So this is when your strainer comes in. And for this phase, basically the way you do it is mix the soup. Let's say you're doing cream of chicken, mix it with water or milk as you would in the instructions, and then strain it. And the fact that it's more liquidy makes it easier to strain. You could also do any kind of milk substitutes like oat milk and almond milk. Those, however, have a lot less protein in them than regular milk. So you could definitely benefit from putting protein powder of your choice into those products. So this is when you want to start, trying to get your protein intake in. And then you continue to sip water in between servings, which are, as mentioned, same size, 3 ounces. This is also when you would start your chewable multivitamin and your chewable calciums, which is essentially all of them need to be separate. So the best, easiest way to follow this regimen is a multivitamin in the morning, first calcium in the afternoon, and second calcium in the evening. And at this point, everything needs to be chewable. So The second phase starts on day 6 after surgery. There's an exception. If you are feeling a little bit lightheaded and weak during the clear liquid phase towards the end, like maybe day 4 or 5, you could start sampling a little bit of the protein shake, but do not start any of the yogurts and the soups until day 6. The most important thing to remember in all of this is that for the first 14 days after surgery, it is really important to stick to only liquids. This decreases the chance that you will stretch out your stomach and move the stitches around, which results in the stomach healing in a slightly different shape than the doctor had originally intended it to be. So playing it safe with only liquids really minimizes the risk that you will do this. After day 14, you will have an appointment with the doctor. And lots of times it's also recommended to meet with the dietitian at this point, because this is when you will likely have a lot of questions for me. Liquids are pretty straightforward, but once you start purees, you have a lot more options, a lot more variety, and it is very helpful to speak to your dietitian about how to proceed with this and, discuss whether you're tolerating something, not tolerating something. So definitely make an appointment with the dietitian sometime after 2 weeks when you have started the pureed phase, which will be discussed in the next presentation, the second half, which will be talking about weeks 3 and 4. So again, here's a recap of what you're allowed to have for the full liquid phase. And basically, that's about it. So good luck with everything. And I will see you in the next presentation.